Asthma is not just shortness of breath. It is a condition where the airways inside the lungs suddenly become narrow, swollen, and filled with mucus, making it extremely difficult for air to move in and out. To understand why breathing becomes hard, you must first understand what is happening inside the chest during an asthma attack. What normally happens when you breathe? When you inhale, air travels through your nose or mouth into the windpipe, trachea, then into smaller branching tubes called bronchi and bronchioles. These tubes carry air deep into the lungs, where oxygen enters the bloodstream. The airways are normally open and relaxed. Air flows smoothly. In asthma, this system becomes disturbed. What happens during an asthma attack? When someone with asthma is exposed to a trigger, three major changes happen in the airways. One, airway inflammation, swelling. The lining inside the bronchial tubes becomes inflamed and swollen. This swelling narrows the passage where air is supposed to flow. Even a small amount of swelling can greatly reduce airflow because the airways are already small. This inflammation makes the airways extremely sensitive. 2. Bronchospasm, muscle tightening. Around the airways are smooth muscles. During an asthma attack, these muscles suddenly tighten and squeeze the airway. This is called bronchospasm. Imagine squeezing a soft straw. The hole inside becomes smaller. That is what happens in asthma. This tightening further blocks airflow, especially when trying to breathe out. That is why people with asthma often struggle more when exhaling. 3. Excess mucus production. The swollen lining produces thick mucus. This mucus can clog the already narrowed airways, making breathing even more difficult. So during an attack, the airway is swollen, tightened, blocked with mucus. This combination severely limits airflow. Why? Breathing becomes so difficult. Because the airways are narrowed, less air reaches the lungs. Oxygen levels may drop, and carbon dioxide may build up. The body senses this imbalance and tries to compensate. The person begins to breathe faster, use extra chest and neck muscles to pull air in, feel chest tightness, experience wheezing, a whistling sound from air moving through narrow passages, cough repeatedly. The feeling can be frightening, like trying to breathe through a thin tube. What causes someone to reach this situation? Asthma attacks are usually triggered by specific factors. These vary from person to person, but commonly include allergens, dust mites, pollen, mold, animal dander. When inhaled, the immune system overreacts. It treats harmless substances as dangerous invaders and releases chemicals like histamine. These chemicals cause inflammation and muscle tightening. Respiratory infections, colds, flu, or viral infections can inflame the airways and trigger attacks. Smoke and air pollution, cigarette smoke, burning charcoal, exhaust fumes, and strong perfumes irritate the airway lining and provoke inflammation.